ACM and Lorna, we're ready to go in 5, 4, 3, 2, 1.
Hello, everybody. Good afternoon and welcome. Welcome to our weekly COVID-19 media briefing with County Executive Marc Elrich, with Dr. Travis Gales, our health officer, also Dr. Earl Stoddard, who is the director of the Office of Emergency Management and Homeland Security for Montgomery County Government, and Dr. Gilberto Zelaya, Public Engagement and also PIO for the Board of Elections. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government. And as weekly, this is a briefing for the members of the media. Remember to use the chat to ask permission to record and also to request to ask questions. And with that being said, Mr. County Executive, opening statement.
Okay, so just welcome everybody here for our continuing COVID briefings. I guess as long as the COVID's around, we're going to be around. So thanks for joining us. We are on the COVID-19 information. We are continuing to closely monitor the uptick in cases we've seen recently. This has occurred not just in Montgomery County, but pretty much throughout the state. Both there's some smaller increases in our positive establish partnerships with community groups, and these partnerships have really helped us get the number of people tested to increase, and we're reaching communities that we really need to get access to the testing. Through our partnership with organizations like Mary Center, we conducted testing at Mega Mart in Tacoma Park, and it's an example of how we're taking testing to where the people are. Please go to our website for testing locations, and I want to encourage people to please get tested. Don't wait till you get sick. Don't assume that everything is fine. Please go out and get tested. It helps us with our information and establishing and a better understanding where this virus is in the community. So when you do this, you're actually helping us get a better grasp on the presence and the spread of the virus in Montgomery County. And please go to our website and schedule an appointment. Voting in elections, they're now less than 2 weeks away. That seems unbelievable. And our Board of Elections is working diligently. Voting is just absolutely important, and I encourage people to vote early if they can to avoid the lines that will be present at the polls, because you're never going to have fewer polls, fewer polling places. So if you can do the early voting, please go out and do the early voting or get your mail ballot in. All these things are visible on the county website now. And we have Dr. Gilberto Zelaya here from the Board of Elections, who again is going to talk to all of you about voting and address any questions you have. We have a Montgomery County Economic Development Corporation restaurant and retail grant. It's $5,000 that's going out to restaurants and retailers to prepare for the upcoming holiday season and winter months. And eligible businesses can submit grant applications through November 5th. Please submit the applications. We don't want to leave money on the table. So we need you to submit the application so we can make sure that money goes out. Any locally owned restaurant or retailer with fewer than 100 employees can apply. The grant is targeting 10 corridors that'll be given priority. Those corridors are Burtonsville and Briggs Cheney, Wheaton and Glenmont, White Oak, Aspen Hill, Germantown, Damascus, Tacoma, Langley, Four Corners, Montgomery Hills, and Twin Brook and White Flint. These 10 corridors were selected with community input and recognizing how severely COVID-19 has impacted the way restaurants and retailers interact with customers. This initiative is going to support technical assistance and new business expenses that may have been unanticipated prior to the pandemic, including e-commerce solutions, delivery service fees, and auto insurance costs related to deliveries. The grant is designed to supplement, not duplicate or replace our existing COVID-19 related funding programs. So this is in addition to. And for more information on that program, you can go to the Montgomery County Economic Development Corporation website, which is thinkmoco.com. ThinkMoco is one word. And with that, I'll turn this over to Dr. Stoddard.
Yes, I'm up first. Okay, so good afternoon. I have a few things I want to touch on. So as the county executive alluded to, we are working on with industry leaders on the HVAC guidelines. We did meet with some of those industry representatives last Friday and are awaiting some of their feedback on our proposal. The proposal is largely based on the guidelines developed by the American Society for Heating, Refrigerating, and Air Conditioning Engineers, ASHRAE. They put forward some COVID-related guidelines that are very well designed, and ours parallel much of those, as well as some other pieces from the European Union's Centers for Disease Control and elsewhere. We are also working on getting out a big tranche of our FEMA submissions, and this is a story with the County Council last week. As we told the council yesterday, we will have $18.2 million submission going out to FEMA by the end of the week Friday. As we have done every month since March, we have just submitted and gotten approval from FEMA for continuation of our feeding programs. We've been getting a monthly request, or submitting a monthly request and getting a monthly approval to continue those programs. That will make many of those programs eligible for, particularly with the bulk food and prepared meal purchases, We've done about 5 million pounds of food since April 1st distributed, and about 4 million prepared meals distributed since April 1st of this year. And so those efforts continue and will continue into the next year. We know that, and we're planning and preparing for that. The last thing I do want to talk about is late night alcohol sales program. As we talked about with the county council yesterday, we have met one of the criteria that would normally lead us to suspend that program. Dr. Gales and I have both reviewed and are continuing to review the public health numbers, and the reality is our numbers were increasing before that program took launch, and frankly, it's impossible for us to attribute the significant increase that we've seen to that program launching. We continue to do compliance checks with those businesses. And frankly, as Dr. Gales, I'm sure will continue on, we are looking at some more holistic potential keyword there, rollbacks if our numbers continue to continue to increase or remain very high. So while we have not suspended that program, it is something we are looking at on a daily basis, and will continue to do so. And it's entirely possible that that program could, I want to be very clear, we don't want this to happen, could be suspended as part of a larger effort to restrict certain activities should the cases continue to arise. As Dr. Gales will echo, I'm sure he nor I take any pleasure in reporting increases in cases, nor do we have any desire to have to implement more strict measures. We've been operating for at incredibly high levels, as you all have, as many county employees, as nonprofit and other workers have, for 7 months. We'd much rather this be over with than continuing or ramping up. And so that's certainly where we are, but we will do what we need to do to protect our residents and keep people safe. So with that, I think Dr. Gales will go next.
Good afternoon and happy Wednesday, everyone. Good to see you all again, and hope you and your families are staying safe. To echo what has been said so far, our goal is to keep folks safe and hopefully continue to guide us through this pandemic and get us to a point where we can resume at least some semblance of back to normal activity before COVID knocked on our doors and entered our homes. So to that point, I want to just briefly level set some things for folks at home. The first thing I want to make sure that folks at home understand is this. So yes, I think as of this morning, in the last week, 39 states plus the District of Columbia had seen increases in cases from the previous week. And I think 16 of those had seen record increases compared to where they had been before. And that can be scary. That can also seem to cause a lot of frustration, and it could also seem to be defeating. But what I want to assure you is that much of the infrastructure that all of us banded together to build early on in the pandemic, when we were talking about surges and peaks and all of those types of things, in terms of building up capacity, both in terms of our healthcare system, as well as our testing platform, as well as contact tracing, all of those essential components. I do want to remind you that because of that, we do have lots of playbooks and guidelines in place to help deal with those realities, should those become our realities in terms of an increase in cases. We continue to work with our hospital partners to further those conversations, those ongoing conversations related to surge capacity. We haven't forgotten those, and we meet with them on a regular basis to continue those conversations to have a full understanding of what resources they need on a daily basis, but also certainly if we see an increase in cases, a sustained increase in cases. And so in addition to that, I also want to spend a little bit of time to, again, level set where folks are in terms of how we would make these decisions. So lots of people have asked, well, when are we moving to phase 3, or what types of factors are we using to make decisions? We've laid those parameters and metrics out on our data dashboard. They have been public since probably early in June when we had our first press conference to talk about the different measures that we look at to guide our decisions. Now, we have refined those and tweaked those based upon looking at some of our neighboring jurisdictions, such as the District of Columbia, as well as other jurisdictions across the country, to mine best practices to figure out the best way to make sure that we're looking at the right things and we're distributing and disseminating it in a way that is understandable and digestible to folks at home. And so we continue to prioritize and use as primary criteria to guide those decisions, including our test positivity. And as was referenced by the county executive, the test positivity is below 5, which is a typical or a standard baseline for many jurisdictions, including the state of Maryland. And ours has been somewhere, it's been as low as I think 2.1%, to now it's probably up in the high 2s, or yesterday I think it was at 3.1. The take-home message is we will continue to monitor that. But even when looking at test positivity, it's important to break that number down to tell a more comprehensive story. So the test positivity that gets reported is the overall test positivity for everybody in the county. And so not only do we look at the test positivity, we also look at the percentage of new cases. And if you recall back in late July and August, we saw an increase in new cases and an increase in test positivity for those in our younger group, 0 to 19. Now that's leveled off some, and we're starting to see an increase in the percentage of new cases in our older populations, those 40 and up. I'm included in that number, so I'm looking at that a little side eye as well. And so we're seeing a slight increase in cases in that population group, as well as an increase in the test positivity for those older age groups as well. And that's important because we know that older groups are more susceptible, based upon the epidemiology so far of the pandemic. They're more susceptible to having, or more likely to have, or have an increased risk of having more severe outcomes related to COVID, including more likely to be hospitalized and more likely to experience COVID-related fatalities. So we're keeping a very close eye on that, as well as a potential indicator of what may come in terms of our hospitalization rates. Now, we have seen reports that hospitalizations are up across the state. We have seen a slight increase in hospitalizations for acute bed usage, as well as the percentage of hospitalizations related to COVID illness, as well as an increase in COVID-related ICU utilization. And so, again, two other primary criteria that we look at are our cases per 100,000, as the county executive mentioned. We have crossed the threshold. Now we're averaging over 10 cases per 100,000 residents a day. And also looking at our rate of transmission, or our R0 value. Again, these values are captured on our county dashboard on the county website. And our rate of transmission has gone up. I think it was last below 1 at the beginning of October. It now sits at about 1.14, I believe, and was actually up as high as 1.34 last week, towards the end of last week. So some of the secondary criteria that we look at, so based upon that right now, we are seeing increased cases per 100,000. We're seeing increased test positivity in certain age groups that give us pause, and we are seeing a slight increase in our rate of transmission. Now, when we look at secondary criteria, those types of things are looking at our hospital utilization rates, which I've already referenced so far, as well as our ability to do effective contact tracing and making sure that we have adequate testing apparatus in place to make sure folks have access to tests. So those numbers continue to move forward and hold steady with slight increases. And again, we put all that together to determine how we would move forward, whether we need to walk back provisions in terms of closures, or how we would look at measures in terms of reopening things. I want to caution folks at home, we're going to put this information out in written format and hopefully update our dashboard to reflect this to make it easier at home to follow. But the strategies that we're thinking about, should we need to walk back any provisions or make closures, is our first attempt will try to make tweaks to capacity limits and those types of limits before making blanket closures on businesses or types of businesses, unless there is very clear guidance, as Dr. Stoddard mentioned, that contact tracing shows that a particular activity or a particular venue is tied to a significant increase in cases. Now, certainly, hopefully, again, if we have to take measures, I'm not saying we will, we're just preparing and making sure that we're clear and transparent about the metrics that we're using to guide those decisions, and that the public is aware of those, is that would be our hope and our first effort And if numbers don't continue to improve, we would likely have to move to have conversations about closures of businesses and those types of things. So we continue to, again, monitor the trends. We don't want to have to walk anything back. Again, we would love to see the numbers as low as we've talked about, moderate transmission levels, where we're talking about 30 cases per day, and even certainly lower to lower transmission, where we're talking about single digits or low teens. The reality is that's just not where we are right now. But I do want to reassure folks at home that we have copious plans in place, and we have done a lot of work in the behind the scenes and background to make sure that if we do see an increase, a continued increase in numbers, that we are ready to respond and we're keeping you safe at home. Thank you.
Dr. Zelaya, do you have some opening remarks? Mute yourself.
So good afternoon, everyone. So it's an exciting time. Yesterday was the deadline to request to vote by mail. So moving forward, now we're going to focus our efforts as it pertains to early voting, which will start this coming Monday, October 26th through Monday, November 2nd. Montgomery County will have 11 early voting locations from 7 a.m. to 8 p.m. We are lining up our resources and our poll workers to serve our Montgomery County voters. Please note, an excellent tool to use to gauge the wait times during early voting is texting the letters EV for early voting and your zip code, EV and your zip code to 77788. And then the system will kick back the closest early voting locations according to that zip code, the address, driving directions, and wait times. So it's an excellent tool for you to kind of, set forth before stepping out of your home and to decide which is the closest early voting center. So once again, from Monday, the 26th of October through Monday, the 2nd of November will be the onset of early voting. And in addition, for those individuals who missed the voter registration deadline, which was 2 weeks ago on the 13th of October, you can leverage same-day voter registration during early voting and on election day. By all means, bring a Maryland driver's license, permit or ID, or a bank statement, utility bill, or other governmental document that has your name and current Montgomery County address. And then the last effort after early voting will be on election day, which is Tuesday, November 3rd. We will be open for service from 7 a.m. to 8 p.m. Keep in mind, as long as voters are in line at 8 p.m., no matter how many individuals, we will serve every single voter accordingly. By all means, you could use, once again, your text system. We have 39 vote centers in Montgomery County. The 11 early voting centers that we will leverage will be converted to vote centers. We will also add the full complement of Montgomery County Public Schools and the White Oak Senior Community Center, the Nancy Dasik North Potomac Community Center, and the Marriott Hotel Montgomery County Conference Center. So you have a robust 39 locations in which you can leverage. And before you step out, text the letters for vote centers, VC, and your zip code. And that will give you the closest vote centers, wait times, address, and driving directions. So by all means, use the tools available to make your vote plan.
Thank you, Dr. Zelaya. Thank you, gentlemen. And we have the first question from Chris Gordon, NBC4. Chris.
Okay. Thank you again very much for having these weekly updates. We find them very helpful. Last week you said they're concerned about the increase in cases in Montgomery County will be critical over the next 2 weeks with COVID concerns increasing regarding the election. I have a question for Dr. Zelaya and a question for Dr. Stoddard. Two separate questions. For Dr. Zelaya, if you'll describe if the mail-in and absentee voting ballots that have already been sent in, have they been counted in any way? People are asking if they got an email or a notification that they've been received. Have they been counted, the mail-in? When will they be counted? And what is the first result we'll be getting election night, November 3rd at 8 p.m., through that evening? What results in terms of what groups of votes that have or will be counted at that point? And for Dr. Stoddard, we had talked about poll watchers. Both campaigns probably want poll watchers. Is there concern about security and anyone showing up armed.
So I'll respond to the questions regarding the voting by mail. So as of today, about 369,987 mail-in ballots have been sent, and we have processed as received and canvassed 180,660. So we have scanned in as received 180,660. We're actively incorporating that into the canvas. Our goal on November 3rd, once all vote centers in the state of Maryland, not just Montgomery County, when all vote centers in the state of Maryland have closed, we will release the early voting outcomes from the 26th of October through the 2nd of November that evening. And then we will release any canvassed and scanned mail-in ballots. And then we will release the election day, November 3rd results. Obviously, we will continuously canvass and process mail-in ballots. Please make sure that you get your ballot to us. The sooner the better. But the ballot drop boxes are available until 8 p.m. November 3rd. For the closest drop box, you could text the word box, B-O-X, and your zip code, and you could identify the closest ballot drop box and post office. In Spanish, that the similar system is buzón without the accent, buzón, and your zip code. And just a quick reminder to our voters, please use a black ballpoint pen. Make sure you sign the voter oath on your return envelope, and that you completely blacken and you circle in your selections accordingly. But by all means, the sooner you send your ballot, the more we could canvass and the more we could incorporate to our accounts.
When you say canvas, does that mean votes are being counted?
Yes.
Already
Yes,
counted?
so they're canvassed through the canvassing process to be introduced to our scanners to be counted.
And Dr. Stoddard, are you concerned about security and anyone? What are the regulations about poll watchers or anybody by near polling places or election centers or the Board of Elections showing up carrying a weapon?
So a couple things. So the governor did extend the distance beyond election sites. It's 100-foot protection or from electioneering and any of those activities. Normally it's I believe a 25-foot range, but it's been extended as part of the emergency given the length of lines that we anticipate from the requirement of physical distancing. We have been meeting with Chiefs Jones, Sheriff Popkin, Chief Goldstein, Board of Elections and others to try and make sure that we've got a good security plan in place and good security procedures. There's not a unique threat, and actually we do get guidance from both the FBI and the Maryland State Police with regard to any specific threats. And that right now there are no specific threats to Montgomery County nor the state of Maryland. So those things are important. Obviously, Maryland's gun laws are much more restrictive than many other states across the country. We do not anticipate seeing some of the scenes that we have seen in other voting locations where people are open carrying in a manner that others perceive as being intimidating. But certainly this is something we are constantly watching. In addition, we are constantly monitoring the other issues that arise across the country. For example, we are aware of the effort that was made to put a ballot box on fire in California. That did result in about 200 ballots being impacted in California. We follow those we get updates from our fusion center at the Maryland State Police on regular threats to election security. And so we are absolutely trying to stay ahead of what happens during early voting, what happens on election day, and what happens on the days following election day, both across Montgomery County, but across the region and the state as well. So I certainly think Police Chief Jones could give you a more detailed and nuanced legal answer on the carry laws, but my understanding is because of the way that Maryland state law is set up, that is a much less risk in Montgomery County than it is in other states, even in our region.
Thank you. Rebecca Tan with the Washington Post. Questions for Dr. Gales. Rebecca?
All right, welcome back, Dr. Gales. I hope you were able to take somewhat of a restful time away. From the contact tracing data that we're getting back right now, are you able to say whether there are any significant differences from this uptick in cases versus what we saw in April or May? And then I also have a second question regarding schools, but would love to hear your response to this one first.
Well, thank you. It's good to be back. Um, I'll say that tongue in cheek. Occasions or not. But I think to your question, it's a little bit tricky to compare because unfortunately back in April and May where we were getting slammed so heavily by, when our daily averages were 200 and 300 cases a day, it made it more challenging to fully complete the contact tracing process. And so we don't have as full of a picture for those cases as we do now. We do know that back during that time, we did see a higher percentage of cases tied to congregate living situations, such as our nursing homes, as well as still some influence of travel-related transmission at that time. But simply, we just, the volume was too high, so we don't have as thorough an understanding. Fast forward now, I would imagine that some of the things that we're seeing now may have contributed to case transmission back then, but we really continue, as the county executive pointed out in his opening comments, we continue to see a high percentage of those cases testing positive, having attended family gatherings or having attended larger outdoor gatherings and spaces, which suggests, again, to his point that he made in his comments, that there may be some loosening of restrictions and letting down of guard, so to speak, when we are around individuals that are in our family networks or who we feel comfortable and familiar with. There may be folks who are less likely to adhere to those physical distancing guidelines and adhere to wearing face coverings and things like that. And so that remains a concern, and it remains part of our messaging as we move forward to, even though, yes, we recognize that there is significant fatigue, everybody's tired, from having to deal with this, but we cannot let down our guard, and we have to continue, even in spaces with people we're familiar with, who are part of our families, particularly those who don't live within our households, that we don't have regular contact with. It's important that we adhere to those guidelines to minimize any potential transmission within those networks.
I would add one additional comment to that. We are seeing in the state data the expected transition away from outdoor recreational and dining activities and the percentage of people who have reported having done those things, and that's it's almost shifting one for one over into indoor dining and indoor activities. As the weather gets cooler, this is what you would expect. We've also seen statewide a 2% increase each of the last several weeks, 2% per week, moving with a greater correlation. This is statewide data with religious houses of worship as well. It's gone from 19 to 21 to 23% over the last 3 weeks. So those are some of the other trends we've seen.
Got it. And before my next question, Dr. Gales, just to clarify, so you're not seeing a surge in congregate living settings for now?
For now, we haven't, and I attribute that in large part to the efforts on a local level as well as the efforts of the state to make sure that there is routine testing in place for those facilities, particularly tying that to as part of their requirements before they can reopen in different capacities to visitors and taking in new patients. So I think that has played a significant role, because what really hit us hard, if you think back to March and April, during that time, there were two things that were happening. One, we did not fully understand and realize the impact of asymptomatic individuals being able to transmit the virus to others. And so as a result, we think what happened is that there were a number of instances where there were employees who were asymptomatic, who even in instances where people were doing temperature checks, they were asymptomatic and were unknowingly transmitting to residents and other staff members within those facilities. Now, if you recall, once we had a firm understanding of that is when we put in tighter restrictions around face coverings and PPE and working with and dealing with residents and patients within those facilities. And so based upon that, those improvements and the routine testing strategies that have been put into place, For now, we can say, fingers crossed, that we have not seen comparable increases in cases in those particular populations.
Got it. And one last quick question. There was an NPR report this morning that described two international studies and one American one that said that doesn't appear to be any consistent relationship between school reopening and the spread of the virus. I'm wondering, given this new research as well as the time that has passed, I'm wondering whether you're thinking in your guidance on school reopening, whether it's changed at all.
Well, I confess I have not had a chance to read through those studies, but anytime we get new results from a study, we also take the time to look to see, to check out the quality of the studies and the information that goes with it. So what I can say is that since we have reopened schools in some capacity here, we have had over 130 different investigations involving cases or COVID-like illnesses that have required contact tracing investigations. And we have over 40 active investigations right now involving schools in different capacities. So, our job is to follow the guidelines and continue to provide up-to-date guidelines and best practices to schools so that they can open safely. But as it relates to any previous guidelines that we've put out, we don't have the advantage when we're making decisions of looking into the future to find out what the studies show. We have to make decisions, in real time, based upon the data that we have. And so we continue to stand by the guidance that we put forward, and we continue to hold true to that. And we continue to also hold true to the promise that we will work to make sure that we have vetted all types of studies that come in and provide new information and present that information to our residents and our constituents in a way that they understand and in a way that they understand that we're using it to keep them safe.
Okay. Jack Moore with WTOP with a question for you, Dr. Gills. Jack?
Yes, Dr. Gill, so the figures for cases per 100,000, I was wondering if you could just kind of say a little bit more about what that means and kind of what are the CDC guidelines for that, and what does it measure? Is it community spread? Is it transmission? And then specifically that 10 figure, when we've crossed that threshold, what does that mean for people on a concrete level?
Sure, Jack, that's an excellent question. So you can think of the cases per 100,000. It's basically taking, before we started representing it that way, it basically takes our daily case count that you're used to hearing where we say, oh, it was 104 cases today. By breaking it down by case rates, it allows you to be able to compare, different jurisdictions, regardless of population. So for example, 104 cases in a jurisdiction like Montgomery County of nearly 1.1 million people is a little different from it's still 104 cases, but when you look at the rate, 104 cases in Garrett County, for example, that has about just shy of 30,000 people. And so it gives you a sense of, kind of equalizing the playing field based upon population. And so that's why there's been a shift to represent those numbers by cases per 100,000 as opposed to just a raw total. Now, numbers are numbers. So yes, we say it's 10.5 per 100,000, but 104 cases or 158 cases, those are real numbers. And we also look at that too, but it just allows for better comparison. Now, the reason why 10 is used is because frequently, whether you're looking at the state criteria or you're looking at the CDC criteria, they often use cutoffs to kind of give a sense of the rates of transmission within communities. So for example, if you were to look at the guidelines that the state produced, or actually the CDC produced for schools reopening, a number less than 3 is considered to be low risk of transmission. A number between 3 and 10 is considered to be, or 5 and 10 is considered to be moderate risk of transmission. And a number greater than 10 cases per 100,000 is considered to be a higher, to be put at risk of a higher risk of transmission. So that's why we use those baselines and markers to, again, get a sense of where we stand for community transmission. And so the reality is, as that number increases, that translates to you're seeing more cases within your community, and thereby you're increasing the likelihood that you and a resident within that particular jurisdiction it's increasing their likelihood that they're going to come into contact with an individual who's positive and thereby potentially contract COVID on their own. Does that make sense?
Yes, and when the CDC, is that, those are daily rate of daily cases would be 3, 10, is that right?
So and I'm going to confuse you. So welcome to epidemiology. It's probably going to confuse you with it. So it depends. So for example, it just depends on the marker that you're using. We try to use consistent markers with, the state. So for example, when we're talking about 7-day averages for the total or 7-day averages for the rates. So it just depends on the particular data set that you're looking at and what their frame of reference is. As it relates to us, we're using the cases per 100,000 on a daily basis. And so the averages that we're talking about, so as the county executive mentioned that, our average today is 10.5. That means on a daily basis right now in the last 7 days, we've been averaging 10.5 cases per 100,000 residents on a daily basis. And so that's our frame of reference. And that's also consistent with how the state is reporting that information as well.
Okay, Dan Schere from Bethesda Beat has a couple of questions. Dan?
Hi there. This question's for Dr. Gales. There have been some cities in the country where at restaurants, customers have to provide a phone number or some form of contact information for contact tracing purposes. I wonder if the county would ever consider implementing a requirement like that, and if so, what would be the metrics for doing that?
So the short answer and long answer is yes. It's something that we have discussed, and the county executive is smiling because he has mentioned that a number of times, and so we are comfortable with including that as part of our parameters and provisions. And there's no magical metric to do that. I know the District of Columbia they implemented that practice early on in the pandemic, similar to what they were doing in the state of Washington early on as well. So there's no magical cutoff or threshold, and it's something that we will most likely incorporate in our guidance moving forward to those types of businesses.
Thanks. And then I had a question for the county executive. The Office of Consumer Protection the other day had sent out an advisory about high commission fees for third-party delivery apps. And I know you had mentioned that you were interested in a legislative remedy for that. Can you say a little bit more about that?
We're looking right now whether or not we can impose a legislative remedy. Could we limit the fees that are charged on third-party deliveries? And when I get an answer, and if the answer is that we can, then we'll talk with the council and try to come up with a proposal that everybody finds satisfactory. I mean, we know restaurants are struggling, and when people are taking as much as they're taking off the bill, if you know anything about the restaurant business, there's probably no margin left after they pay their delivery fees.
All right, and we have one last question from Caitlynn Peetz from Bethesda Beat, and the question is directed to Dr. Gales. Caitlynn?
Hi, good afternoon. Dr. Gales, you kind of touched on this a little bit, but I wanted to get into it a little bit deeper. Can you just give me an update on the number of confirmed cases and outbreaks there have been, both at public and non-public schools? And second to that, as we're starting to get into the fall where we would expect to see colds, allergies, flu, etc., are you seeing an increase in reports from schools of possible or COVID-like illness and things like that?
Sure. Thanks, Caitlin, for the question. So for the hard number in terms of the actual cases, again, I apologize. I don't have that number in front of me. We can get that number and calculate that number of cases for you. To the second question, You've introduced one of the issues that does make it challenging from a contact tracing perspective, because by the state guidelines, schools are required to report not only the lab confirmed COVID cases, but again, anyone who comes in with a COVID-like illness. And just to remind you all, and I don't think we've talked about it in this call, I know we've talked about it in our calls with the schools on our Friday sessions. So COVID-like illness is defined as this: any one of the following symptoms: a cough, shortness of breath, with difficulty breathing, or a new onset of loss of taste or smell, or conversely, at least two of the following symptoms, including a fever of 100.4 and or higher. Fever is 100.4, not 104, 100.4. Chills, muscle aches, headaches, sore throats, nausea, diarrhea, fatigue, or congestion or runny nose. And so everything that I just listed, you're right, that mimics and looks a whole lot like a whole lot of other things that not necessarily COVID. But because of the guidelines and the extra level of precaution we have to take, if anyone in a school setting is demonstrating those symptoms, they're required to report that. And it is treated like a COVID case until otherwise proven not COVID by a lab test. And so we do expect that, or there's potential for it, given that this is flu season. It's also allergy season to some degree. And for pediatric illnesses, RSV season, and a host of just common cold season during this time anyway, we do anticipate that we would see an increase in calls from schools reporting individuals coming in with those symptoms. It underscores two important principles though. The first one is a lot of those symptoms look a lot like the flu. And this is one of the big reasons why we are encouraging everyone to get the flu vaccine to increase your protection from the flu, which decreases the likelihood that you're going to show up in your school, you're going to show up in your business, or wherever you go with any types of symptoms related to the flu. Again, which look a whole lot like what I just listed in terms of a COVID-like illness. And the second thing is, it's important that if individuals are demonstrating symptoms, just stay at home if possible. You know, whether that's a kid going to school, you showing up to work. If you do have the ability to do so, we strongly recommend you to stay at home if you are demonstrating any of those symptoms. And we certainly would recommend, given where we are, you accessing either your medical provider or the many different options that the county provides in obtaining a COVID-19 test.
All righty, thank you, Dr. Gales. That was the last request for questions on the chat. And with that, journalists, going once, going twice. All right, we're done for today. Thank you, everybody, for joining us. We'll see you next week. Have a great afternoon. Thank you.
Thank you.